Ronaldo is a 40-year-old male, and he presents with lipodystrophy caused by tritherapy. I think he's a good candidate for treatment with BeautyFill. Now we'll apply an infraorbitary and Mentonian bilateral nerve block. I'm going to identify the segment and then infiltrate it. In this case, we use a nerve block not only to anesthetize, but also to prevent the deformation of the area. I'm going to inject this anesthetic here in the Mentonian foramen. Now, as you can see, this patient has a severe depression in this anatomical triangle. It's very common in patients receiving chronic tritherapy. We mark the area to be treated. I'm using a blue marker to define this triangle that doesn't have any immediate bone support. You know, it seems the depression is a little more severe on the left side. We're also going to fill the temples and the area under the zygomatic bone, but being very cautious about the facial branch of the frontal nerve that runs through here. For the temples and the infrazygomatic areas, which have bone immediately under them, I'm going to use the red marker. Now, what plastic surgeons traditionally relied upon in these cases is facial surgery, like autologous dermal fat grafts. In a case like this, though, the graft would have to have been taken from the back of the neck or a similar area. Now, the problem with the autologous dermal fat grafts is that it tends to partially reabsorb. Also, the procedure is time-consuming. The donor area needs to be sutured, and the patient needs general anesthesia and a longer recovery period. The other traditional treatment is fat grafting using Coleman's technique, which requires, again, a donor area and general anesthesia and, of course, a longer recovery period. Now, it's helpful to estimate the length of the needle you'll need. I come in at a 90-degree angle with an 18G needle. It's possible to use a cannula also, but I prefer this needle. I'm trying to reach the tip of the triangle we just drew. And start injecting using the fan technique. The skin of this patient offers more resistance to injection because he's lost a great deal of fat tissue, and the elasticity of the skin has also decreased. We make sure that we're in the deep dermal plane, although in a patient with this amount of volume loss, it might seem as if we're at a more superficial plane. Now, we inject while pulling the needle out using the fan technique, and we have to be careful not to leave any product in the superficial dermis. I tried to go as superficially as possible into the deep dermis. Please remember, it's the fat that's missing, and the muscles are the ones that prevail. This zone here is limited by the major zygomatic, the orbicularis oculi, and the levator labii muscles. Now, we come in at the inferior angle of the triangle we drew, again using the fan technique. I push the plunger nice and easily to avoid the irregular accumulation of the product in the path of the injection. I see we have a little more filling to do in this zone. So I'm going to do that using the fan technique to form a crosshatch, starting with the third angle of the triangle. So to recap briefly, the total amounts of Beautifil injected were, on the right side, 2.6 milliliters. On the left side, 3 milliliters. The right side was more difficult to inject. The resistance we found confirmed that we were in the deep dermis. The result is evident immediately after injecting the product. Massage is very important in all cases, but especially in cases like this one, where I've injected large amounts of the product. Now we're going to do the temple and then the infrazygomatic area. Well, it's an excellent result, really, a dramatic change. Considering the condition of the skin, this outcome is very, very good. Very symmetrical, nice and balanced. Well, I like to prescribe a non-steroid anti-inflammatory for my patients for, 2 or 3 days, preferably a COX-2 selective inhibitor.